As India is now facing the emergence of coronavirus as a part of pandemic coronavirus infection, we are into third phase of the viremia, where we are going to see sudden and rapid explosion of number of cases of coronavirus that will happen in our country. If we learn this from countries who have experienced this, and what we realize is that if we follow good practices, we will be able to curtail this spread of virus and we will be able to minimize the damage that this virus can cause us. If you see the example of Italy and if you see the example of Singapore, the stark difference between these two countries which tell us that if you act early, if you screen patients early, and as an individual, all of us, if we follow strictly the hand hygiene practices, so our message will be that basically stay at home, avoid social contacts, avoid social gatherings, avoid travel if unless it is extremely necessary, and follow sneezing and coughing etiquettes. Make sure that you use handkerchief or a tissue and dispose it off properly. And number 3 is that to wash your hands more frequently. Plain simple soap is good enough. No need for hand sanitizer. As you know, there is a shortage of hand sanitizers across the state, and even if you use just plain simple soap and water, that is good enough. If you are going into crowded places, that time you can cover your face with a handkerchief. Masks also are in shortage, and masks, the N95 or higher category masks are used only for healthcare professionals when they come in contact with cases with respiratory tract infections. So that is not required. Don't get panic if you are not able to get higher category mask. Just use plain simple handkerchief and cover your face with that. That is good enough. Avoid contact of your face, mouth or nose frequently, because that is the portal of entry of the virus. So make sure that your hand is clean with soap and water, and avoid contact your face, mouth and nose, because that will be the otherwise entry of the virus in the body. Other than that, if you have cough, fever, and if you have visited any of the countries which are high risk countries for coronavirus, which are China, European countries, and any other country who has reported cases with coronavirus, then you must seek help of health authorities, and you should take a proper consultation. There are strict criteria which have been laid down by Government of India for screening of patients for coronavirus. So see your doctor. Don't rush to health facilities directly for screening testing, because that is not available in private labs, and there are criteria which your doctor will be able to explain to you if you require it or not. Don't get panic. This is the time when we have a responsibility for ourselves, for our family and for our community, and I'm sure if we all work in a cohesive manner, then we should be able to tame this coronavirus. Wish you all the very best, and wish you all a good health, and I wish that we are able to get this problem under control very soon.